Hi everyone, welcome to the next episode of the Explain series. Today we're going to be talking about slut-shaming, more importantly about pre-exposure prophylaxis. So that is a tablet you can take to prevent the acquisition of HIV. It is a very good method of ensuring or protecting yourself and reducing your own personal risk, and that's the whole point of taking it. And so there are two methods of taking it. One is you take one tablet every day and you just keep on taking it and just get a sexual health checkup every 3 months. The other way of doing it is event-based dosing, where you take 2 tablets 2 to 24 hours before the sexual event, and then 1 tablet per day until you're 2 days clear. That's the 2-1-1 method, and that's another easy way of taking it. Some people are a little bit paranoid and take another tablet on the 3rd day, so it's the 2-1-1-1 method. Either way, there are the two methods of taking pre-exposure prophylaxis. Taking a pre-exposure prophylaxis pill like PrEP, otherwise known as Truvada, is very sensible for your own personal risk reduction. The problem is I've encountered quite a few people in my clinic when I offer them PrEP completely free of charge, doesn't cost anything in the UK, and they turn it down, even though they are at high risk of contracting HIV. So the question is, why do they turn it down? And the answer I get back is, well, if I take it, it just feels like I'm wanton. I just want to have sex all the time, and I'm taking that pill because I can't control myself. And I turn around to them and say, well, what you're doing is you're self-stigmatizing your personal views onto sex, onto yourself, because you're going out there having sex with individuals, and you are obviously not liking what you're doing, but you're trying, or you're coming up with a method of ensuring that you don't reduce the risk. I then say to them, because these are men I'm talking to, and I say to them, if you had a teenage daughter and she's taking the pill because she wants to prevent pregnancy, would you give her the same kind of attitude, the same kind of presence, that it's you're being a slut if you're taking this kind of contraception? And they all turn around and say, well, no, of course not, because that's sensible. You don't want to be pregnant at a young age. And it's the same thing. And throughout our society, it doesn't matter if you're gay, straight, male or female, there are medicines out there which you should have to prevent something from happening in the future. So in the 1950s and 60s, the pill for contraception was invented, and the amount of abuse in the media was and all the stories about women who are going to be overly promiscuous because they will have sex in a consequence-free environment. And it wasn't the case, because that's not how humans work. Sex and being driven to sex is completely different. There's also cultural values and society values, which means it's got the two are a little bit detached. And having contraception to prevent the risk of pregnancy is a very, very sensible thing, and has got nothing to do with how promiscuous an individual has, or how many partners they have, or anything like that. It's just a very, very sensible method of controlling basically birth control. That's it. So it doesn't matter if you use PrEP once a year. If you just go off and have sex with some random person you don't know and you don't use any protection, then you're going to pick something up, or you could very well pick something up. And so you reduce that risk to near enough zero if you take pre-exposure prophylaxis correctly. And I'll just quickly say this, for if there's any women watching this far into the episode, the correct way for a woman to take PrEP is every day continuously, and if you are going to take it event-based dosing, you have to take it for 7 days before the event, and that includes, if you're taking it continuously, 7 days before the event, and then every day continuously, and then you can stop it until 7 days after the event. So 7 days before, 7 days after, or you can just take it continuously, providing you take it for 7 days before the actual event, and then you just continue taking it. The reason why there's a time difference for men and women is because of blood supply to the genital area. That's it. Any questions, feel free to give them below. Get yourself checked for sexually transmitted infections if you're sexually active, and stay safe. Enjoy. Take care.